We're at an interesting time now in the cancer conversation. There are 77 million baby boomers in this country, and we know that the greatest risk factor for cancer is age. So we are going to be seeing a lot more cancers, people dealing with multiple bouts of cancer, recurrence of cancer. So I think the time is now. It's a critical time for us to be investing in innovation so that we can bring better treatments and bring cures for people with cancer.
Given the pace of scientific advancement, it's really time to do business differently. And keeping the patient at the center means really recognizing that they're the ones that are volunteering for research and waiting for new therapies to be brought to them. And so no matter what standard procedures are in place, we all need to stop what we're doing and remember why we're doing what we're doing. And that's to accelerate the pace that new cures are becoming available.
I was diagnosed in December of 2003 with stage 3B cervical cancer. Medical innovation is extremely important because patients need to have the best knowledge to make the best decisions for their treatment options so they can live the best life they can when they're done.
I think we all need to work on this together, every aspect of the community. The patient advocacy organizations need to educate patients and those at risk for developing cancer that they should have access to clinical trials and to the most appropriate and innovative new therapy for whatever condition they may have.
Part of innovation is ensuring that we have a regulatory environment that's ready for that innovation. It's not enough just to work on developing and discovering these new compounds and drugs. We have to make sure that the patients are ready to participate. We have to make sure that the regulatory environment is ripe to look at these new drugs and innovations. And we also have to look at the reimbursement environment and at cost to make sure if we're investing in these great innovations that we can bring them to market, but that patients can actually access them and afford them, that physicians are willing to prescribe them, and that the third-party payers are willing to pay for them.
As a patient, you look at what is cancer going to cost me, and there is a concern. So depending on where you are in your stage of life, if you are in part of the working world, if you're a younger person, you certainly want to be back in society and be productive. So it's really important that you look at all your options and what's going to get you there. What's your quality of life going to be? And even if you're out of the working world and you're retired, you still have so much to give back to the community. You've got families that depend on you. You want to be with your grandchildren. You want to take your grandson fishing. You want to see your grandchild get married. It's all important. So you need to look at what these trials are and what hope they can offer you going forward. And hopefully we're on the horizon for doing bigger and better in cancer. It's a 2,000-year-old disease, and we haven't cured it yet.
The biggest highlight is March of this year, I hit the 10-year cancer-free mark. And that impressed me because I was given the 50% chance to survive. So that really made me feel like I've accomplished something amazing.